Hi, this is Dr. Mitchell Yass, and this is another episode of YouTube Live. I've been mostly just recording my sessions, but I figured maybe to allow this one to go live in case anybody had questions while I was talking, they'd have the opportunity to ask them and I'd have a chance to answer them. So this talk is about probably the most important topic there is relating to addressing the pain that roughly 130 million Americans and 1 billion people seem to be suffering with, right? There's this chronic pain epidemic that began back in the late 1980s, early 1990s, and has not stopped at all. My concern is the fact that there was this rising awareness that there was this systemic issue relating to how the medical establishment addressed pain, but that kind of wavered and has dissipated substantially, in my opinion, since 2013, when the National Institute of Medicine did this position paper and came out with all the information regarding the situation, including the fact that 130 million Americans suffer with chronic pain, that it costs the country over $630 billion a year, where cardiovascular care only costs the country $400 billion. It is clearly the most expensive aspect of healthcare that exists today, not just in the United States, but worldwide. And the probably most disconcerting aspect of their position was the fact that they came to the conclusion that the reason for chronic pain is simply the fact that the brain is simply igniting pain signals without there being an actual cause. So not that there's a tissue in distress, simply the fact that your brain just said arbitrarily, I'm going to start shooting off pain signals, and you're experiencing pain. And the conclusion that they came to was the fact that the only way to address chronic pain was through hypnosis or pain medication. And I clearly remember back where Dr. Oz, as soon as this came out, Dr. Oz did a show about it, and he had 4 pain management doctors come on and asserted that there's no question this is the situation and these are the types of doctors you need to see to address your pain. And in my mind, I mean, I'd been treating pain for 20, 30 years, by 20 something years by that point. And it really enraged me. And it enraged me because you kind of have 2 possible ways of looking at this chronic pain epidemic. You could take their approach, which is to say they are doing everything correctly. They are getting the right diagnosis through the use of the MRI. They are treating the right tissue in distress. And the problem is that just as they described, you've got the right treatment. They've treated it. There should be no distress of any tissue, but your brain just haphazardly is eliciting symptoms. That's one thought process. Or the other thought process is they suck at diagnosing. They haven't even remotely been close on diagnosing the true tissue in distress, the true cause of your symptoms. And therefore, you're getting the wrong tissues treated, which is leading to the tissue in distress remaining in distress, which allows it to continue to emit its emergency distress signal of pain. Which would you suggest sounds more logical? That there is this new concept relating to humans that somehow just out of nowhere for no reason, the brain just started eliciting, shooting off pain signals? Does anyone actually want to accept this as a justifiable reason for 130 million Americans and 1 billion people suffering with chronic pain? It's insanity. Insanity. But the medical establishment, certainly globally, is a behemoth. It's huge. It's huge. It's a combination of medical practitioners and pharmaceutical companies and insurance companies. And it kind of just all works as a whole. And they dictate policy, and poor little people just have to go through the process based on whatever they're telling you. And, you're always hearing about these, private insurance is the answer, or national healthcare. Then none of that matters. It wouldn't matter what country you're in. I've treated people from Taiwan, from Switzerland, from Canada, from England, from Portugal. I don't care what country you're in. I'm telling you now that it is a systemic failing of the global medical system, and it relates to what this topic is about today: getting the right diagnosis. Now, the average person I don't think really understands what that diagnosis is supposed to represent, what's supposed to be contained in the diagnosis. So I kind of wanted to hit it today and help you to begin to have a more clear thought process. You're in pain, you're seeking care. I kind of want you to have a better sense of what you think you should be looking for, what you should be expecting in those that you're going to get this care. So you have symptoms, you seek care, you're looking for the correct diagnosis. What is a diagnosis? A diagnosis is supposed to be a representation of a tissue. It must contain a tissue which, through some means, has been identified as the tissue in distress, eliciting the very symptoms you're experiencing. You must understand the way this works. Your symptoms aren't arbitrary. They're not coming from any particular tissue. They're coming from the tissue in distress. How do you know that? What is the common thought process if you have pain at your chest and your left arm? Do you just ignore that? Do you say, I'm going to see my doctor in a few months. I'll worry about it. I'll wait till then. No. You say, pain at the chest and the left arm is a symptom of distress of the heart. I'm having a heart attack or some major problem with my heart. So you associate those particular symptoms with your heart. If your entire left side of your body goes dead, you can't feel it. You don't say, I'll make an appointment in a couple of months and we'll check it out and maybe we'll come to a conclusion. No, you say that symptom is representative of distress of my brain. I think I'm having a stroke. So those are the kind of instances where you recognize that the symptoms are representative of a very specific tissue in distress. And therefore, you seek care from the appropriate individuals, and they treat the tissue, which then allows it to no longer elicit the emergency distress signal of those symptoms, and you don't have symptoms anymore, right? That's the way it should work. The problem is when it comes to the neck, the back, and the extremities, that's all gone. Nobody buys that premise. That is not what the medical system is selling. The medical system, as most of you know, if you've tried to seek care in the last 5 to 10 years, you know that the way the system works is that you go in, they ask where your pain is, they give you a prescription for an MRI, and then you're told, come back and we'll discuss the results of the MRI. So you'll have symptoms, and you get an MRI, and it'll show a structural variation, a herniated disc, arthritis, stenosis, a pinched nerve, meniscal tear, labral tear, fracture, any of these types of things that always show up on these diagnostic tests. And it is asserted that since those structural variations are identified at the time you're having your pain, it is the cause of your pain, which is known as correlative theory or junk science, which is baseless, because I could say the MRI would show you have 2 elbows. at the time you're having your symptoms. So why can't we say 2 elbows is the cause of your pain? You could if you follow the same logic. You would also have to recognize that as many people without pain have the same structural variations. Probably the most clear indication of that is the studies that show that of people who have knee pain, 63% are found to have meniscal tears. That meniscus, the cartilage between the thigh bone and lower leg bone, right? 63% of people with knee pain have a meniscal tear, while 60% of people who don't have knee pain have a meniscal tear. Right? That's very, very close. If meniscal tears cause pain, how could you have roughly the same amount of people who don't have pain having the same meniscal tears? Right? And you could go on all throughout the body, and you'll see that as many people without pain have the same structural variations, which are being identified as the cause of your pain. And that's clearly breaks the concept that the structure that's identified is the cause. So that's kind of the scientific premise when you look at studies. So they're kind of working on the premise that they've identified a tissue when they say herniated disc or stenosis or any of that stuff. The problem is the second part of what is required for a diagnosis to be a legitimate diagnosis. Remember this premise. Let's be very clear. We are saying that the diagnosis represents the tissue in distress eliciting your symptoms because the symptoms are being created by that tissue. And every tissue creates specific symptoms. We got to get this concept down. So if a structural variation were to create symptoms, it's going to create very specific symptoms. The problem is that in more than 99% of cases I've ever treated over 28 years, the symptoms the individual was having did not match the symptoms you would expect based on the identified structural variation being called the cause of the symptoms. Think about what that says. Think about how important this is to you getting the right diagnosis and thereby getting the right tissue treated so you can end your symptoms. If your symptoms don't match what you would expect of the identified tissue, what do you think that means to you? Clearly, the tissue identified is not the cause of the symptoms. They just keep depending on the idea of correlative theory. Well, it was found while you had your symptoms, therefore I can say it's the cause. That is insanity. It is straight out lunacy for anybody to accept this as a viable, logical presentation. Nobody with any scientific background would ever accept correlative theory. Correlative theory is the kind of theory that says if I eat more broccoli, I reduce my chance of cancer. Well, along with eating more broccoli, my suspicion is you also eat a lot of other good things. Maybe you exercise more. Maybe you're less apt to smoke. Maybe you're able to reduce your stress. So there are multiple contributing factors. But you can't say that eating broccoli on its own can reduce your chance of cancer, because what if you're eating lard at the same time? Trust me, the eating broccoli is not going to offset the eating the lard. But that's correlative theory. That's why no one takes those types of studies as being valid. This is the real deal, folks. You got to start wrapping your head around this. I am a champion of the people. I am trying to show you that there is a reason why all the treatments you've gotten, all the specialists you've seen, all the time you put into this, that you're still in pain, if not more pain. There's a reason. And it's not that you haven't gotten the right treatment, and that's what you think, because you keep going from practitioner to practitioner, different types of treatments, different types of medications. You're hoping for some change, but you're never going to get that change because you're not treating the right tissue, the tissue in distress. Now, to me, the best thing I can provide you in terms of a sense that there's hope that you can resolve your pain is the fact that in more than 98% of cases, the tissue that presents based on the symptoms of those I've treated over these 28 years was muscular. Even with the stupid MRI diagnoses that were identified, even though everybody tried to push you towards that, when that person came in with that diagnosis and then I actually evaluated their symptoms, the symptoms indicated they couldn't be from the structure because they weren't where they were supposed to be. And I'll give you a couple of examples so you can understand this, right? They were always muscular. And that's why, even with that diagnosis, I was able to resolve the person's pain and bring them back to full function within weeks. I never even addressed the structural variation that was supposedly the cause of the pain. And yet the person had a full resolution of symptoms and full return of function. So just briefly, I'll try to give you a couple of examples of how symptoms don't match the diagnosis. I'll just do one or two in a couple of areas. So one of the more common ones is the pain in the upper trap region right here. You could see that's not my spine, right? But you're going to get a diagnosis. Someone's going to convince you the pain over here is related to your cervical spine. You'll get a herniated disc, a pinched nerve, right? And you're beginning to tell that's the cause of the pain. Well, let me show you a concept about symptoms. So if herniated discs are causing your pain here, then if I want to incite this pain and make it worse, I certainly would have to press where? If it was a pinched nerve, I'd have to press on the pinched nerve, right? I have to press on the spine. So I can press on my spine, and I'm never going to create the symptom there. But if I press right here, I'll bring on the pain, I guarantee it. So what did I just show you? Well, the symptom that's associated with a herniated disc creating this is that it's a referred symptom, meaning that the cause of the pain is not where the pain is being experienced. They're saying it's from my spine, and this is where I'm feeling the pain. But what you actually present with is the fact that when I press on the spot, you do feel the pain. I can ignite it. I can make it worse. Well, that's called point tender pain. And point tender pain is not referred pain. So if I could show you that your pain is point tender and not referred, it can't be from the disc. And the tissue I'm pressing on happens to be a muscle. So once I present that to you, does it matter how many specialists you go to for your 10th opinion that tells you have a herniated disc as the cause of your pain, when your body clearly shows that it's point tender pain, not referred pain, so it couldn't be coming from the disc? You got to take the logic, forget the people. All of these people are educated in the same fashion. The medical establishment hasn't changed their methodology in 40 years. They just keep recycling the same nonsense because they're allowed to. But that doesn't mean that you have to accept it, and certainly doesn't mean that you have to remain in pain. And that's where I come from. That's it, man. That's my essence to you. That's my message to you. I am the guy battling for you. I am the guy trying to show you why, with all your attempts to try to get better, it hasn't worked. What about symptoms that keep changing? Good question. Okay, so let's talk about that concept. Okay, you had pain on the left side of the body, and then you now have pain on the right side of the body. What happened? Is there some kind of mystical symptom that seems to find its way and float around your body? No. Let's talk logic. So you had pain on the left side of your body, maybe in the hip region, because you had strained some muscles. The force requirement of your activity was greater than the force output of your muscles, right? You live in a gravitational environment. Gravity is pushing down on you. Your muscles have to push up. That's the way it works, right? If your muscles aren't strong enough, they're going to strain and elicit pain. That's why you have pain. So let's say that you had pain on the left side of your body due to muscle straining. Are you going to be able to weight bear equally on that left side as before the pain? The answer is no, because your body's never going to allow you to have pain. It will always try to offset any pain you have by causing you to do something. What? It's going to ask you to compensate. The body will convince you to compensate. So what's it going to do? It's going to shift you from weight bearing on the left side to more weight bearing on the right side. So what did you do? You just shifted the forces. The amount of force that has to be supported and absorbed by the muscles is now gone to the right side. Well, that's a force that it wasn't designed to take. You're supposed to take 50% on both legs. Well, now you put it all on the right side. So guess what? Now you're going to strain on the right side. And suddenly, because your weight bearing more on the right than the left, you don't have the pain on the left. Now you have it on the right. That's why your pain constantly keeps going back and forth. What you have to understand is that it takes large groups of muscles to perform activities. And if all the muscles aren't strong enough, one muscle is going to compensate for the weaker muscle, and you're going to use muscles in the way that they're not designed to work. Right? So that muscle strains, then another muscle tries to compensate, and that strains, and so you just have this cycle. See yourself as a chain of muscles. And when one link breaks down, another link's going to try to take up the slack. That's why you're constantly having this shifting. Then that takes the load too much, and that breaks down. Now another muscle, and it could be side to side, it could be at different joints, but ultimately that's the essence of it. I think what pisses me off more than anything is the person that gets the hip replacement at the left hip, and then due to the post-surgical pain and swelling, ends up making it almost impossible to weight bear on that leg. So they excessively weight bear on the right leg, and now they have pain at the right knee. And 3 to 4 months later, since they've always told them not to do anything initially, they always wait a few months, because the goal of the system is to make it seem like every time you have a pain, it's an independent situation. It's a new episode. They never want to connect it to the old episode, because if it was connected to the old episode, it would be a considered failed surgery. So they always need to spread it out. That's why for 2 to 3 months, they'll tell you, don't do anything. Don't bend, don't twist, don't do anything, right? But now this poor person who had a left hip replacement is having pain at the right knee. Now, 3 to 6 months later, they'll get the x-ray of the right knee, and now they're told they're bone on the right knee, right? So now they're told they need a knee replacement on the right. And I've had people cycle back and forth getting their joints replaced, all on this false premise that their joints are slowly deteriorating ever since the first surgery, which is insanity. Insanity. There's so many things that are wrong with that premise, but it's so ridiculously common. So, in that regard, let's just talk about this concept. Let's say you're having pain around your kneecap, okay, at your knee joint, right? Your pain is around your kneecap. If you sit too long, if you go upstairs, you go downstairs, you kneel, you have pain around your kneecap. You go to the doctor, they get an x-ray or MRI, and it says you have a meniscal tear, you got arthritis, or you're bone on bone at the knee joint, right? Here's what you have to understand about that diagnosis. It's insane as to the cause of pain. It's not even possible to create your pain. Here's why. Again, knowledge is power. Who am I? I'm the guy who's trying to give you the knowledge so you could understand what you need to understand so you can help yourself make the right diagnosis. The diagnosis must be a tissue, and the diagnosed tissue must represent the symptoms being experienced, that it can create those symptoms. In this case, listen, you got pain around your kneecap. You're told that you're bone on bone, or you have a meniscal tear or arthritis at your knee joint. What part of the knee joint? They're saying that your structural variation is at the joint between the thigh bone and lower leg bone, right? That's where the meniscus is. That's where they say the arthritis is, between the thigh bone and the lower leg bone. Well, your pain is at a different joint. The knee joint is actually comprised of 2 joints, the joint between the thigh bone and the lower leg bone, as well as the joint between the kneecap and the thigh bone. That's 2 separate joints. So saying that a meniscal tear or arthritis or bone on bone at the joint between the thigh bone and lower leg bone is creating pain at the joint between the kneecap and the thigh bone is like saying I have arthritis at my elbow and it's creating ankle pain. That's how stupid this is. That's how irrational this is. But you don't have the education or the know-how to know that. That's what I'm here for. That's why I do all that I do. And by the way, just to be clear, I was educated like everybody else in the medical establishment. I have a doctorate of physical therapy. I went to medical school. I followed the educational cycle that everybody else did. But my God, it became so apparent fairly early on that what they're teaching is irrational, purely, completely irrational nonsense. And I'm the type of person, based on my father's education when I was a child, that I could only accept things that are logical. And so I went on this path after graduating medical school, to try to understand how do you interpret the symptoms that people are experiencing, because it was evident to me that the symptoms are the telltale to what tissues in the stress, the proper way to find a diagnosis. And I think the thing that's really given me such joy is the fact that I was able to show that in more than 98% of cases, it's a muscle responsible for your symptoms. So let me briefly just explain the concept. And hopefully with that understanding, we can walk away and we can say that now you have a better understanding of what a diagnosis should incorporate, and hopefully be able to determine whether, or at least ask questions as to whether a diagnosis given to you is correct or not. So let me just point this out. So muscles create symptoms in 4 primary ways. They can either cause a muscle constraint and elicit pain, or cause another muscle to compensate and elicit pain. So you have pain in the muscle. That's the more common one everyone thinks about with muscle, but they don't think about these 3 others. So muscles attached to joints, to the bones that make up joints, for instance, like the kneecap. The kneecap is controlled in its tracking through the knee joint by the front thigh muscle, the quadricep. It's attached by a tendon. And then there's other muscles that attach to the kneecap. So the positioning of the kneecap as it tracks is based on muscular forces. So variations in muscular forces can cause mistracking. So you could have pain at a joint caused by muscular deficits, weakness, or imbalance. So that's another one. Muscles can refer symptoms, and most people don't know this, although they do know that a symptom of a heart attack is pain at the chest and the left arm. Clearly, there's nothing wrong with your chest or your left arm. That's referred from the heart. And what is the heart? It's a muscle. So you kind of do know it. You just don't think of it about when it comes to skeletal muscle. But if you're laying on your side and you wake up and your hand is numb, all the establishment is going to say, let's go get a cervical MRI because it's going to come from the nerve roots, which is pure crap. Ultimately, it's a muscle in the rotator cuff group that has strained and overstretched from the way you were laying, and it's actually sending signals down to the hand, right? So that's a muscle referring a symptom. And finally, fourth, muscles constrain and impinge on nerves. So, for instance, the great one is sciatica. Sciatica is actually the result of a muscle in the gluteal region called the piriformis impinging on the nerve. You have a neurological symptom, but a muscular cause. You can spend all day at the neurologist for the rest of your life, get treated by a neurologist or a neurosurgeon. You will never resolve sciatica until you recognize it is a muscle impinging on a nerve. So it's a muscular cause. So those 4 possible means of creating symptoms accounts for 98% of all the people suffering with pain. That is what I've been able to determine over 28 years. So the 2 big points I would like to summarize and complete with are: what has to be in the diagnosis? A tissue must be described. For every person that has been diagnosed with pain around the kneecap as patellofemoral pain, that is not a diagnosis because there's no identified tissue. It is simply an identification of a symptom. Pain at the patella, the joint between the patella and the femur. That's not a diagnosis. That's worthless, right? And how many people go to the doctor, the orthopedist, and are given patellofemoral syndrome. Stupid. By the way, the word syndrome is the key indicator that the person has no idea what's causing your symptoms and yet still wants to treat you. The phrase syndrome implies a group of symptoms with no etiology. So let's look at a couple of others. In the shoulder, shitloads of people will be diagnosed with impingement syndrome. Right? Impingement. So what's the tissue? Show me an atlas of the anatomy and show me the syndrome, the impingement tissue. I don't know of any impingement tissue, right? Again, just meaningless. But they get away with it because you don't know. Well, now you do know. If they give you impingement syndrome, you have to say to them, well, you didn't tell me what tissue's in distress, so therefore that's not a justifiable diagnosis, so I need you to think a little harder, work a little harder for me, and try to give me a better sense of what's causing my pain. Because I came to you to get the proper diagnosis, which is to say, I want to know what tissue's in distress so we could address it appropriately. To me, the saddest and most disappointing one is failed back surgery syndrome. Anyone who got that and is willing to accept that and continue to go to that practitioner who gave them, I feel very, very sorry for you. Very, very sad. Failed back surgery, so think about the diagnosis. It simply means you had a failed surgery by this person and they don't know why you're still having your symptoms. The word syndrome, right? Failed back surgery syndrome. So any of those types of diagnoses, don't accept. Don't accept it. If the word syndrome's there, if there's some sort of phrasing that doesn't identify a tissue, then don't accept it. Secondly, and most importantly, make the person giving the diagnosis have to explain how they know that the symptoms you're experiencing are coming from the tissue that they are describing. So like when the herniated disc comes up, they got to be able to tell you, how did that herniated disc cause pain at the side of your back, let's say? Because the disc is in the spine, which is in the center of your back, and you're having pain to the side of your back. So I need to understand what's the mechanism by which that herniated disc can cause pain at the side of my back when it sits in the center, right in my spine. That would be an interesting thing to hear. If you're having pain around your kneecap, they got to be able to explain how they keep talking about structures in a different joint, creating pain at that joint. Right? They got to be able to use your symptoms to be able to tell you what tissue's in distress. That's what the Yass method is. If you want to know what separates the Yass method, I mean completely from the medical establishment. I'm not aware of anyone who's doing what I'm doing. I'm not familiar with any medical practitioner who has straight out said they want the MRI abolished as the primary mechanism for diagnosing the cause of pain. I have said it. I am on record. I want the MRI abolished. I want the interpretation of the presentation of symptoms of the body as the primary mechanism for diagnosing the cause of pain. Because that's what you need. You have to interpret the symptoms to know what tissue is creating those symptoms, right? That's what I'm for. Right? I'm not aware of anybody else talking about this. That's why I believe I'm a servant of the people. Because I'm promoting what people really need. Not what they get, not what doesn't work, but what they need. That's what's important. That's what I'm promoting. So those are the two big issues I want you to wrap your heads around. A diagnosis must describe a tissue, and the symptoms being experienced must be representative of the symptoms that that tissue would create if in fact it was in distress. If you have those two things, then you have a proper diagnosis. Those are the types of things you will get with the Yass method. So I kind of had already put up on the side here my email address, drmitch@mitchellyass.com, if you want to get in touch with me if you're having symptoms and you think that the Yass method sounds like it might be for you and you want to discuss it, by all means, you can contact me at drmitch@mitchellyass.com. If you decide you want to go ahead and make an appointment for a Yass Method Zoom session, the vast majority of what I do is through Zoom. If you happen to live in the Jacksonville, Florida area and you want to do an in-person session, by all means. But the majority of what I do is through Zoom. I was doing Zoom before Zoom existed, mostly through Skype. But if you want to make an appointment, you can at the website Live Without Pains, it's plural, livewithoutpains.com/sessions. That's how you can get an appointment. If you like this video, give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added, or just like this, when I'm live on YouTube. So I think that will end this session. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.